Thank you all very much for coming. This meeting is being recorded and it is live streamed on Facebook. If you have questions for our speaker, please put them in chat and we'll give them to her for the recording. Good evening. I am Roxana Dean, President of the League of Women Voters of the Comal area. Welcome to this program, which will focus on the state of healthcare in Texas. The Comal Area League serves Comal and Guadalupe counties. We envision a democracy in which every person has the desire, the right, the knowledge, and the confidence to participate. The League is proud to be nonpartisan, neither supporting nor opposing candidates or political parties at any level of government, but always working on vital issues of concern to members and the public. Anyone 16 years and older may join the League. It is not for women only. Please visit our website at lwvcomal.org for more information. Everyone should be muted and your video turned off. This will make for a smoother meeting. You can type questions into the chat, or if you're on Facebook, write your questions as comments. I would like to introduce our speaker for this evening. Andrea Roja is a certified health education specialist with an MS degree in health education and an MA degree in psychology. She is a health education adjunct professor at Dallas College with over 25 years of experience in the fields of healthcare, fitness, and community health. She is the current issue chair for LWV Texas on healthcare for indigent Texans and for the elderly. Thank you so much, Andrea, for speaking with us tonight.
Thank you for having me. It's my pleasure to be here. So there are a couple of documents, two documents that I uploaded in the chat for those that are attending via Zoom. I'll also share them so they can be uploaded to the Facebook page as well for people to download if they'd like to look at those. But I'm going to reference those two documents, so that's why I wanted to give everyone an opportunity to really look through it, or if they want more information about some of the issues. As we know, the legislation is now in session. All the bills were filed as of March 12th, and so now it is a task of us going through everything that has been submitted to provide testimony or advocacy on some level, whether it's an action paper or an action alert, or, like I said, testimony. But before I get into that a little bit deeper, as the Healthcare Issues Chair, the area that I cover is healthcare for those of lesser means. And the League's support, or their statement on that, is support for a basic level of health care for the medically indigent, including children of low-income families, support for expansion of Medicaid payments. And Medicaid expansion is really the biggest issue right now, and there are so many bills that have been filed that are related to the expansion of Medicare. So I'm going to go over, Medicaid. So I'm going to go over those. But also, one of the other advocacy issues that I cover for healthcare is healthcare for older Texans, which is supporting adequate funding for a comprehensive healthcare system for older adults that ensures a seamless continuum of quality care. Ways that we advocate a lot of issues is through action papers. There is one action paper loaded on the League's website right now for those two issues. And action papers are based on League positions and are used to build support from legislators and the public. It also helps League members effectively communicate our position. We also have action alerts, and there's a new tool, a relatively new tool available on the League's website that allows anyone to go on the website and look at all of the action alerts. And if there's an alert you feel strongly about, you can easily submit that to the legislators of your area just with a click of a few buttons. I mean, it auto-populates the letter, the action alert. You click off to confirm the legislators you want it to go to, and it sends it to them. So it's a lot easier than, asking everyone to write their own letters and things like that. It's very pointed and very specific. And action alerts, they're prepared by issue chairs. And what it is, it basically asks the legislators to take an action on issues that are needing immediate attention. Testimony is another area where we provide advocacy, and that's kind of the stage we are in right now, action alerts and testimonies, because most of our action papers have already been filed and posted for legislators and the public to look at. But testimony comes after we actually look at all the bills that have been filed, and we make a statement in support or in opposition to pending legislation, committee or commission action based on the league's position. And so we have that work to do this week, moving all the way until May, because the legislator meets for 140 days, so it ends on May 31st. So with that said, I know I mentioned that Medicaid is the hot issue. One of the documents I loaded is a bill list, and it's not inclusive of every bill, but it's a lot of the bills that are being watched that have to do with those of lesser means in the healthcare for older Texans. And if you open that document, it basically gives you all of the bills, kind of where they sit right now. It tells you the legislators that authored those bills. It gives you a little synopsis of what the bill relates to and kind of where it is with the House committee or Senate committee. Well, most of them are with the House committee right now because it just closed basically with all the bills being submitted. Now, one of the pressing issues is the Medicaid expansion. There are about 45 bills that have to do with healthcare for those of lesser means that we're following. Half of those have to do with Medicaid expansion in one way or another. Most of them is to relate to the expansion of Medicaid to certain persons under the Federal Patient Protection Affordable Care Act. And so, as we know, there was debate about rolling back the Affordable Care Act, and we're looking at a lot of bills that want to build on the Affordable Care Act and expand Medicaid. The second document that I loaded also has to do with a survey that was done actually within the last year. And that was Texas residents' view on state health policy priorities, which is very interesting here. And it was conducted by the Episcopal Health Foundation. And they do this report every year. So they did one for 2018, they did one for 2019, and they have the one that they just released in March for 2020. Well, considering that we had COVID, we were working under pandemic conditions, healthcare it's such a priority. I mean, really, at this point, healthcare ranks second to public education as far as the view of most Texas residents, whereas in the past it wasn't quite as high. But also, when you take in consideration that we've been working under pandemic conditions, health is heavily on everyone's mind. Some of the findings from that, and that's what I want to build on for us to open up maybe for a little bit of discussion or to review a couple of things, is that nearly 7 in 10 Texans say they think the state should expand Medicaid. However, a lot of legislators do not want to expand Medicaid. Some legislators have already replied back, some of the Republican legislators, that they don't want it expanded, but that they plan to have an alternative. I don't know what that alternative is. I haven't seen it yet. I'm assuming it's related to one bill that has come up on the list that I noticed. So I plan to contact that legislator to find out specifically how they plan to offer an alternative or what that alternative is. Once I do find out, I do plan to put that on the website and go ahead and do an action alert and probably testimony to support the expansion of Medicaid, but also to have more information from those that oppose it so that we can build a good argument to support the expansion, so we can have a good counter argument. But one of them, I'm getting ready to refer to the list because I made my notes here, is it has to do with what they are referring to as Texas Way, or having a Medicaid buy-in program for employees of small businesses. I'm not sure, again, how they plan for that to work. And the bill is not very specific. It's kind of gray. And so, again, that's something that we need to follow up on to get more information, as well as relating to a Texas way to reforming and addressing issues related to the Medicaid program. And this includes the creation of an alternative program designed to ensure health benefit plan coverage to certain low-income individuals through the private marketplace. So that also sounds a lot kind of like an Affordable Care Act, but a spinoff of it in some way. So I don't know if a couple of legislators, this is authored by Reynolds, but I don't know if there's other legislators that are Republican legislators or other legislators that oppose Medicaid expansion that plan to get behind this one. So we are reaching out to Reynolds as well as Biderman, who also mentioned when an action alert went out to him, his response was basically that they are looking for alternatives because they feel that Medicaid expansion will not work. It becomes more costly in the end. Again, we need more information on that because I don't know exactly where they're getting their statistics from, but we are at the bottom as far as healthcare comes in the US on a national comparison chart. We have the highest rate of individuals without health insurance in the nation. And what's interesting about that is many Texans don't even know that. They don't even realize that. When it comes to Medicaid, we turn down $10 billion in federal funding each year. Medicaid, we're looking at uninsured adults and trying to get more people insured. That includes lower income, but it also includes a lot of older adults as well. One of the findings from the Residents' View on State Health Policy, let me see, I'm trying to advance my slide here. There we go. Okay, so lowering cost is a top health priority for Texans, okay? So as we see there at the top, lowering the cost of prescription drugs is high, lowering the amount individuals pay for health care, reducing the number of women who die from causes related to pregnancy and childbirth, and yes, that is still an issue in 2020, increasing access to health insurance, improving access to hospitals for people in rural areas, expanding Medicaid to cover more low-income Texans, increasing funding for mental health programs. Those issues right there are in the top, 50% or more. And then, below that, we have dealing with prescription painkiller addiction epidemic, increasing women's access to family planning services and contraception, and decreasing state government spending on health care. Now, that has the lowest amount of people that think that it is a top priority with 23%, but still, we're contributing to the national pot for Medicaid expansion. So many other states have done that. And it's like we're putting in money for Medicaid expansion, but we're not reaping the benefits of it. We're not utilizing our tax dollars, our federal funding. Our federal funding for Texas goes in the pot, but we're not utilizing it. All we want to do is utilize that. That alone will increase the number of people that are insured. The next thing is the role of state government in healthcare. Right here, when it comes to making the healthcare system work well, do you think the state government should play a major role, a minor role, or no role? Okay, and so a major role, the total was 66%. So that tells you that the majority of people want change, and they want government intervention as change, which would be expanding Medicaid as well. That would address a lot of gaps in healthcare and preventive care for children, adults, older adults, I mean, everyone, women. So it covers a lot and cast a wider net. The next statistic I want to show here is a third of non-elderly Texas adults lack health insurance. Okay, 35% uninsured. So the question was, are you yourself now covered by any form of health insurance or health plan, or do you not have health insurance at this time? 35% said they were uninsured. 41% they're getting insurance from their employer, but as you age and you retire, you know, or you stop working, retire from working, benefits from the employer, that percentage decreases significantly, you know, meaning that there are fewer people that are going to have insurance from their employers. Medicare or Medicaid is 8%, only 8% right now. So we're looking at the reasons why it's a high priority right now. The league believes, or the position of the league is, a basic level of quality health care at an affordable cost should be available to all persons. I bring that up because there were some bills, one in particular that has been filed that relates to expanding the expansion of eligibility for Medicare in certain counties only. Although we want the expansion of Medicaid, we need it to be expanded and available for everyone, not certain segments. The other thing is, if you make it available in certain segments, you could potentially shift priorities. You can find people that live in one county relocating to a different county just so they can get Medicaid. That puts a stress on other public systems. So we want it more equitable. You know, you don't want to say it's all or nothing, but you don't want to, you know, provide for certain counties and not for others. Healthcare should be available to those of lesser means who are elderly, pregnant, have behavioral health disorders, and to children from low-income families. Another area that many bills are related to with Medicaid have to do with mental health. So there are some that address mental health for children in school, for school counseling, or if the school counselor refers to them to a mental health professional, that would be covered under Medicaid. Others are for adults needing mental health counseling, for that to be covered as well. Texas has a shortage of psychologists. There are several counties that did not have mental psychologists, and there's a discrepancy with nurses as well as mental health professionals. So, you know, while you want everyone to have access, we also need to be able to have the resources. One of the other urgent issues with healthcare is to provide 12 months of continuous coverage for children eligible for Medicaid. Currently, family income could be checked up to 4 times per year per child. Now, this is really being addressed by some very specific bills that have to do with SNAP, the Supplemental Nutrition Program. And that has to do, it's a supplemental nutrition program. One of the two hot bills right now have to do with making it easier or more accessible for older adults to get SNAP, to qualify for SNAP, and to continue on SNAP, because you have issues such as transportation. Um, you know, especially under a pandemic, the requirements of having in person or checking in person, or if it's your first time going in person, having to check in person several times a year for an elderly person or a person with a disability, that's very difficult. And so, like I said, there's two bills that are specifically looking at ways to make it easier for older adults to qualify. Another thing is for anyone, qualifications for anyone. Right now, income things are taken into consideration, such as vehicles that you own. You know, there is a policy of, you know, if you own one vehicle, you know, if it's over a certain dollar amount, you cannot qualify for SNAP. Well, if you look at last year with the pandemic, and even this year as it continues, there are people that had nice cars, nice homes, that lost their jobs. Um, so whether it's temporary or whether it needs to be for a couple of months or a year until they get settled back on their feet, restrictions like that do not account for you know, crisis situations or a pandemic or anything like that. Uh, so it puts it where a lot of people, as we've seen on television, they're hungry, they're having to go to food banks. Food banks are suffering. All of that ties in with health as well, because if you're not eating well, you can't be as healthy as you can be. Um, when it comes to our older adults, you know, Meals on Wheels suffers. Home delivery options are very limited right now. There's one bill that does address home delivered foods for older adults as well as those with disabilities, and making it easier, or trying to attract other businesses to qualify and be able to do home deliveries under the program, because they may have better means, a greater ability to get those meals to people. And then there's also a couple of bills that have been introduced that are what I call penalty based, meaning they're related to the development and implementation of a program where health benefit coverage is provided to certain individuals, but it also imposes penalties. And those penalties are not clear. So that's another area, or another bill, another couple of bills that I'll need to follow up on with the authors to get more information as to what's the criteria of success, and what kind of penalties are you looking to impose, and you know, what is the benefit, the true benefit of implementing that program versus expanding Medicaid. And I have one other. Nope, that is it. So I guess my questions are, or my question is, that I want to throw out there is, does anyone have any questions or concerns about expanding Medicaid? You know, because that's one of the topics that we really as a league are going to get behind, to try to push that through so that we can get more women, children, older adults covered. The Medicaid, SNAP, There's another issues chair that handles women's issues. So the issues of contraception, the issues of women's health specifically is covered by that issue chair, as well as we have issue chairs for voting rights and other things like that. But there are some things like the redistricting in healthcare and women's care that we're really pushing, as well as climate change. We're in a position right now where we're trying to get together testimony, opposition and support of. Well, that testimony often comes from stories we get from individuals too, of how they've been affected, personal stories. The more relatable, the more personable we can make it, and couple that along with facts, along with statistics, the better of a case we can make to try to push these legislators to either, agree that it should be expanded, or maybe work towards an alternative or a compromise where we can meet halfway, so that it's a win-win for both sides. It may not be the win we're looking for, but it may be an improvement.
This is Roxana. So Mr. Biederman is our Comal County's representative. So if you need something from Mr. Biederman, we could try to help. I know what he says. He's afraid that if they start taking Medicaid money, right now, it doesn't cost the state anything, apparently. And I think in the new COVID relief bill, there's some sweetener to even give states more Medicaid money. He's afraid that at some point the government will pull out and the state will be left with funding it all. That's his concern.
I'm almost speechless in a way.
What can I say? This is the same person who wants to secede from the union. So
right, because my initial thought is, well, we've been contributing for several years now, and the government hasn't pulled out yet. So, okay. Well, that's good to know. I do know that he sent a written response through indicating that that they had an alternative in mind, but did not say what that alternative was. So yes, I may need some help with reaching him to find out, really, to get down to the nitty gritty, because, okay, yes, he says the reason why he doesn't support it. Well, I mean, what would you support?
And the new COVID relief bill, I believe, gives even more money.
It does. It does.
Does anyone else have any questions? We are a small enough group. We could now, Andrea, if you want to stop sharing your screen, we could just all appear. You could turn on your video.
Yeah.
I think it's small.
There we go.
There are, Roxana, there are a couple of questions.
Okay.
In the chat. Jency has asked, I understand that Representative Lyle Larson is supporting Medicaid expansion. Since he is an influential Republican, does that mean that other legislators are changing their attitudes?
Yes and no. He's actually on our list because we want to get with him to find out how we can get more that oppose to meet us to support it, because he currently supports Medicaid expansion as is. We would like others to currently support as is, instead of trying to implement some new program or something to reinvent the wheel along the way. And so if we could have some type of coalition, or let him spearhead some type of, be our intermediary per se, to build a bridge on, where can we meet together, or, what would it take, or what is it exactly, what exactly is it that really makes you oppose it, you know, and because it's to say, to give a reason like, well, the state may pull out, that's a what if. Give us something tangible of a real possibility of, you know, something that has happened or something that you can give statistics to instead of a what if, you know. Um, you know, a what if reminds me of a parent saying, maybe, you know, give a good reason as to why, a statistical reason. I see a question where someone asked, what is the estimated amount Texas would save if Medicaid was expanded? I don't have that exact number, but I have seen that number a couple of times. So I can get back to you with that number and that can get posted on the website.
And along the same lines, when you say that Texas pays into this pot every year, do you have any idea how much we're paying in?
I do. Give me just 1 second. I do actually. Hold on. Yeah, just as I thought I had it right there. Hold on. Give me just 1 second. I need to pull up another document. Hold on. As I try to, I have too many windows open. For some reason, I have 10 million stuck in my, I know the amount we turned down is 10 billion, but let me double check here. Oh, no, I do not have that exact cost. Okay, so I know we turn down 10 billion in funding every year. And the government would pay 90% of the cost. What committees will be hearing the Medicaid bills? It is the Human Services Committee and Human Services Committee. Health and Human Services for Senate Committee and Human Services Committee for the House. So another figure I'll need to find out is the exact amount we contribute. I know like I said, I do know the exact amount is 10 billion in funding that we turn down every year, but how much are we contributing? Okay. Yes. Roxana, do you want me to send the stats to you and you post it to Facebook, or how do you want me to get the information back to you that I need to double check on?
Yes, do that.
Okay.
Can I ask sort of a follow-up to the question about working with Lyle Larson. Are you involved with any of the coalitions that are working on Medicaid expansion?
Yes, every Texan, and then every Thursday, I sit in with the Coalition for Health and Human Services for the State Health and Human Services Department on Medicaid that addresses Medicaid expansion. Is mostly a social worker group, but and they also have other members of other coalitions that attend that meeting as well. So we have those meetings every Thursday from 2 o'clock to 3 o'clock. Usually the first half addresses children and families, I would say, and then the second half, others.
Great.
So Andrea, would you just give a clear explanation of what Medicare expansion means?
Yes, and before I go to that, let me tell you, I do have the number now. I have a little, I have a researcher helping me. So it's 600 million that Texas contributes under Medicaid expansion, which is 10% of federal match. So there's the figure.
That's every year?
Yes. So our contribution, 600 million.
Wow.
And
if we expanded it, would we still be paying into it?
yes, we would. That's the big argument behind it. We're contributing, and we have been contributing, but we have not expanded.
And expanded just means making more people eligible.
Is primarily the income, adjustments to the income of how they qualify for it. It may also be adjustments to, if there are a certain number of disabled people in the home, different ways to make adjustments. So it may be based on need, it may be based on resources. Casting a wider net, making the umbrella bigger.
Okay. Thank you.
The other thing is reimbursement with Medicaid too. That would also need to be expanded as well if you're going to expand coverage of who qualifies. Another way to expand Medicaid is to expand the services that are eligible for reimbursement under Medicaid, because a lot of mental health services are not eligible. There are certain health services that are not always eligible. And so expansion can work a lot of different ways. But I mean, the primary way for it,
we keep losing you.
and costs as well. It's easier to have preventive health, preventing the heart attack or the stroke or anything else that may cause disability, as opposed to paying for the disability. I mean, I think we can all figure that one out.
Sandy has a question. Looking at the list of bills filed, are there any that we specifically plan to support?
Yes, I think I put that one, that on my initial, on the blog. maybe one of the earlier blog posts I did. But it is, so if you look at the list, the one, okay, so I can tell you for sure, the one for SNAP, the Supplemental Nutrition Program, that one for sure. And those are bill numbers because it's 2 of them there. And a couple of them are the same bill, but they're authored by different legislators, which basically means, you know, that there's very little difference, maybe just in wording, but they're both addressing the same thing or almost the exact same thing. There's no difference in the outcome really of what's being asked with the bill. And so if you look at the captions on some of them and you say, well, these all sound almost just the same, or that would be why. But the SNAP bill, it is Senate Bill 224 or House Bill 701. So those we are definitely supporting. And then there's House Bill 1230. And that one, that House bill addressed excluding the value of motor vehicles and determining SNAP eligibility. Right now, there's an asset limit on cars at $15,000 for the first car and $4,650 on the second car, on a family second car. And so if you exceed that, you do not qualify.
Roxana, I think we lost her.
Right.
I lost her.
We did. I guess she'll have to log back in. Should I continue the? So Marilyn, do you want to
Okay.
share?
Yeah, I'd like to talk about, I went to a talk about this kind of stuff, and they were saying there's, let me just see if I can, wait a minute, find it here. That we have a waiver now, an 1115 waiver that is coming to an end, and that is much worse funded than Medicaid expansion. It's a 60-40 instead of a 90-10 kind of funding from the government. But that's coming to an end, and the waiver helps support hospitals, but doesn't insure anyone. So it is money that we're getting from the government, but we're not getting enough of it. We're not getting health insurance to people. There's an expansion waiver. There was someone I listened to, SB 117, where they're trying to get it so that people, the Republicans or more reluctant people would be enthusiastic because it expands vision and dental insurance, but also requires people to go to job counseling, but doesn't have a work requirement in order to get the benefit. We would cover 1 million more people if we expanded Medicaid, which is substantial. We're losing a lot of money this way, but it's come to a crisis point. We have to make a decision at this point because we've lost the non-expansion waiver is coming to an end. So this is a reasonable time to expand Medicaid and get better benefit.
Right.
Okay, I apologize. I lost connection somehow, some way.
Nice to have you back. Marilyn had attended a recent program about Medicaid, so she and the expansion, so she was sharing some things. So we had still had good information. Say that again now. Andrea is here. Marilyn.
Okay, that right now we're covered under an 1115 non-expansion waiver, which helps cover costs for rural hospitals, for examples, but does not insure anyone. But it's coming to an end. And the non-expansion waiver, the government pays 60 to our 40, which is a lot more than what we would get far better benefit to expand Medicaid and get the 90-10 instead of the 60-40. And we would be covering 1 million more Texans with health insurance.
Right.
Expanding Medicaid. So that I know there's several bills that are coming through that to try and expand Medicaid. One of them is this SB 117. I've forgotten the name of the congressperson who was presenting this, but
Johnson.
oh, there you go. But he was saying he thought he could get it through because it required people to go to job counseling, even though it does not have a job work requirement.
Well, that bill, that 117 is the one that also has penalties.
It has penalties?
Yes, and it is supposed to impose some type of penalty, but that part is unclear. It's called Live Well Texas. So that's what he's proposing, a program called Implementation of Live Well Texas program to provide health benefit coverage to certain individuals and imposing penalties. So those penalties may have to do with maybe if they don't attend, the job training or something like that. I don't know. So that's one that I have highlighted to get in touch with to find out more information about that specifically.
Okay, yeah, but we're at a decision point. They have to make a decision because
Right.
our expansion waiver has come to an end.
Right.
We need to help them make the good decisions.
So if you don't ask for a waiver, you automatically are in?
No,
No.
they have different kinds of waivers, but I'm unclear about this.
Yeah, you're not automatically in. That's a good question, and that's one I can find the exact, the specific answer to. But if you don't, if you opt out of that waiver, it does not automatically opt you into, the program for expansion. So I don't know what happens when that waiver expires and if we do nothing else. So that's the big question.
And I think in the COVID relief bill, it's actually not going to, for a while, it's not even going to be 90-10. I think it's nothing. I think you're not.
Right.
Right.
Right. So
Right.
right now is a really good deal.
I know. It's a very good deal. And right now, instead of what if they take it away, it's like, what if we don't, take advantage of it? I think that's the bigger what if.
Kim, you had a question. Would you just unmute yourself and ask your question? Kim?
I'm not sure which question. I put some in.
Well, just ask whichever one you want.
Okay, well, the way I look at this is, my gosh, the money difference is unbelievable. And if leadership in Austin does not accept this expansion, I think it's another reason to say, their leadership is unacceptable. To know people in the rural areas that have to drive so far just to get a broken arm fixed. My gosh, we're in 2021. And to hear these facts tonight, how can people say no to this.
Well, and the other thing, yes, we're in 2020, and it's horrible that people in rural communities, they don't have access to those that are in, the city. But the other thing is also, it's a matter of access because of healthcare coverage. It's a matter of access because of having healthcare professionals. I mean, we are a huge state. We know that. But we're not a poor state. And we should not be ranking at the bottom with regards to Texas residents, not having health insurance. That's just unacceptable. I just can't find a reason to justify that, or a reason to say that we're trying to take care of everyone, but yet you have, the majority, a huge chunk of your population that is not taken care of. There's no access, for basic level of health care.
A possible argument to tell these legislators is that in having more people insured improves their health and improves the productivity. So it will boost the economy. I mean, to leave people uninsured and ill is not a way to get productivity out of our people. They're here. Let's have everyone contribute.
Yes, that's an excellent point. The other thing is, if I have bronchitis and I don't have health insurance, I'm going to be sick a lot longer than if I was able to go to a doctor, get a prescription or an inhaler or something that I can afford and, take care of myself. That you're absolutely right, because if I do have a job, I can continue, I miss the minimum amount of days to get well, or I may not have to miss any days, and so, yes, it does contribute to my productivity. It also contributes to my sense of well-being overall. A lot of people are missing work because of mental health. They don't feel good. They just don't feel good mentally. They don't have the energy. They don't have the desire. I mean, health is physical health, but it's also, a sense of well-being as well.
Well, and I think COVID has showed us that we're only as well as our neighbors.
Yeah.
So maybe you have health insurance, but if the other people around you don't and can't go, it's going to make you in the long run the opportunity to be unhealthy as well and have to go to the doctor more.
Yes. And it is more cost effective for more people to be healthy than sick. I mean, really. Illness and disability, maybe that's something I need to look up more recent too. How much is that costing us?
Since they can't really make a good argument, I don't think, about the money and not taking it, it feels to me it's just not wanting to take anything from the federal government. I mean,
yes, and it's also, I think, the growing mindset against anything that, like you said, that's government related. Everything, especially when it comes to healthcare, if it's government funded or whatever, I hear more and more socialism or socialist, type of healthcare system. And
except they're clamoring for federal vaccination centers.
Right.
Sandy, you had a question?
Well, no, it's not really a question, but these the titles were put into place in the late 60s, and being a social worker since the mid 70s, it's always been this thing of pride that Texas doesn't take federal money. I mean, they have to some, but it's always been trying to keep off as many people as possible from food stamps and from Medicaid. And so you're still battling that whole mentality. It's not logical, but it's
I
just,
know. I had to laugh, not at what you were saying, but it made me think, yes, just like we have to be on our own grid. Yes. Uh-huh.
and hopefully we're like slowly tipping over.
Right.
This question about, did you get the feeling that what was your question about Mr. Larson? But do you get the feeling that there's a little bit of change in some of the Republican viewpoint?
I do. But I do. Let me put it like that. I do. I do, to the point that I do feel like there is hope.
Yeah.
So, yeah.
Well, just like we're losing, I worked in Junction, which is like 90 miles away from anything. And that's when I first saw how bad the rural hospital, we're losing all our little tiny rural hospitals. That people in those kind of counties, you're out in nowhere.
Right.
The only place the only doctor that runs a hospital is the doctor that everybody sees for their primary care. We're starting to lose a whole lot of those hospitals. So
yeah, and even like now with the pandemic, I mean, we're having to look at how do we get vaccines even to people in rural areas.
New Braunfels.
Yeah.
See, that's what's so sad is because, they keep talking about all these people are being vaccinated, like 25% of Americans. And I'm going, well, then why is it still hard? We're not even, most of us got in on the list, but, we still haven't reached all of our elderly and our high priority people here.
Well, Texas is fourth from the bottom.
Yeah.
So when it comes to vaccination, so that tells a lot. I know we have a much bigger state, but again, we have a lot of resources here too. And we are not we're not at the bottom when it comes to financial resources.
That's why I said, how can we say 25% of all Americans are already vaccinated? And I'm like, well, it's not here in Texas.
Right. And the thing about it too is a lot of Texans, like even with the survey that I shared, if you look through there, a lot of Texans didn't even realize that, there were so many people uninsured in the state. It kind of goes back to what Roxana said, it's the health of your neighbors. Sometimes we don't know the health of our neighbors or the health of other people, whether they have insurance or don't have insurance. A lot of times we assume everyone is, or more people than not are insured or getting adequate health care, which is not always the case.
Well, Andrea, thank you so much for joining us, and thank you for all of your hard work. I encourage everyone to go to the League of Women Voters action pages, read what the issue chairs post almost every week about what's going on. As Andrea said, the list of bills are there, and there's a way to just right away click and tell your senator or representative. And even though for us in this particular area, we don't have very far-sighted people, they need to hear that there's another point of view. They can't only hear just what they want to hear. They need to know that we think they're not doing a good job and that there's something different we would like them to do, and that's important. I hope all of you will join us next month on the third Wednesday when our discussion will be preserving natural resources in Comal County. We will have speakers from the Comal County Conservation Alliance and from the headwaters of the Comal. So a topic that we may be making more progress on. It may be a more hopeful discussion. So, but I thank all of you for being here tonight, and especially Andrea, thank you for sharing.
Oh, you're welcome. My pleasure. Okay.
I'm going to stop the recording.